This episode is brought to you by the Weather Channel app. Did you know the app can help you forecast more than just the weather? With allergy tracking and flu risk mapping. So you know when to stay inside and load up on podcast. As well as air quality and UV indexing. So you know when to get outside, load up on sunscreen and podcast. Forecast more of what you love with the Weather Channel app.
Hi, my name is Travis McVeigh. I'm an anesthesiologist from Dallas, Texas. I host a podcast called Thank You Notes at Ars Longa Media. Showing gratitude to people just makes me feel good, and I want to share the practice of thank you notes with everybody who listens. I write thank you notes to people and then bring them on the show to read it to them. Past guests have included my high school teachers, my friends, other physicians, and a couple of internet celebrities. I will also be doing episodes that explore the science behind gratitude practices to demonstrate to everybody the actual tangible benefits of practicing gratitude. Listen everywhere you get podcasts and check out the extras on my social media accounts. Thank you for listening.
Hello, everyone. This is Conrad Fischer. You're listening to the Inside the Boards podcast series, which I love, and I encourage you to take a look at the Study Smarter bundle.
Welcome to the Inside the Boards Study Smarter series for the U.S. MLE Step 1 and COMLEX Level 1, dedicated to helping you learn to think like a question writer so you can study smarter, not harder, and succeed on your exam.
Hi everyone, Stuart here. Now as promised, our continued question dissection with Conrad Fischer. Hope you enjoy.
All right, you're up on this.
So you got a guy, 53-year-old man's on dabigatran or dabigatran, whichever way you like to say it, dabigatran. Now, the boards don't test manufacturers' names, but that is Pradaxa. For those of you who know it only as Pradaxa, dabigatran, for his non-valvular atrial fibrillation. Remember that we should be using a NOAC, a novel oral anticoagulant, for atrial fibrillation stroke prophylaxis for everything except those people who have metal valves. Everything except metal valves and mitral stenosis. So the guy crashed his car into a lamppost and has a motor vehicle accident. He's got bad brain injury. He gets airlifted to a hospital, and the scan shows a big epidural hematoma. His neurosurgeon wants to perform emergency craniotomy. So what are you going to give this guy?
They always want to do that.
Depends what hospital you're at.
Oh, that's a good point.
If the epidural is big and you need to do surgery on a person who's been on dabigatran, what will you give them before you do the operation? Oh, so here's the choice. First, A, bevacizumab, trastuzumab, natalizumab, idarucizumab. Oh my goodness. Who makes up these names?
Yeah,
this is like the names from people who are like, this must be the people who make the names for Star Wars aliens.
Yeah, well, choice E,
Secukinumab.
Secukinumab, yeah, he's one of the Sith Lords in the upcoming Star Wars.
Exactly. Well, secukinumab is a very difficult, all these mAbs, right? And you're not allowed to be able to say to people, that it's just a monoclonal antibody. Secukinumab is an interleukin 17 inhibitor, secukinumab. And secukinumab is for people who have psoriasis, an IL-17 drug. So would you use vitamin K to reverse dabigatran? Dialysis reverse dabigatran? Is there anything to reverse dabigatran? Protamine sulfate to reverse dabigatran? Fresh frozen plasma to reverse dabigatran? Now, I will also tell you that here, this drug is the only one of the NOACs that has an agent to reverse it. The short answer is, what reverses dabigatran? And it is idarucizumab. What reverses dabigatran? Idarucizumab. Let's say it together. 1, 2, 3. Idarucizumab. Yeah. Now, bevacizumab.
So actually, can I stop you or interject really quick? So you make a great point. boards writers love this stuff. You said it's the only NOAC that has a reversal agent right now, right?
Yes.
So that seems to be pretty high yield because you can write a test question off of that, such as this one.
Well, the point about what you say is that it's like an IQ test. Which one of these is different from the other four? We have apixaban, rivaroxaban, edoxaban, the 10A inhibitors. Apixaban, edoxaban, rivaroxaban. There's no agent to reverse them. Ooh.
That's a bummer.
Well, it makes it easy to write a question, though. So
it does.
The wrong answer is bevacizumab. Bevaciz. Beva. Beva is, by the way, Patrick, what's the most common cause of blindness in the United States?
Macular degeneration.
Very good. Very good. Macular degeneration. Bevacizumab is a VEGF inhibitor that stops macular degeneration. It is a vascular endothelial growth factor inhibitor, bevacizumab. There's ranibizumab and bevacizumab that stop macular degeneration. Stops it in 97% of wet macular degeneration and reverses 1/3. Trastuzumab.
Yeah, that's pretty good.
Trastuzumab, you know that. Bobila?
I do.
What is trastuzumab, Booby? Booby?
It's for breast cancer.
For boobies. That's right. Who's got breast cancer?
Like 1 in 8 women at some point in their life.
Her too?
Yeah, her too.
Her
she
too?
Does.
That's what trastuzumab is. It's our HER2 inhibitor. HER2? Who's got breast cancer? 1 out of 8 women. HER2? Trastuzumab.
I like that. That's a mnemonic too. See, all these little things are going to play back in your mind as you go to take step 1. You're going to hear Dr. Fischer, if you go to the Cramathon, saying things like that, and it's going to stick. Who has breast cancer? HER2, trastuzumab. You'll remember it.
Like a fecalith in your circle of willows.
What?
You won't be able to get me out of your head.
Oof, that's graphic.
You're pretty sensitive for a gynecologist. You're pretty sensitive for a guy that does episiotomies, man.
Well, no, I acquired this sensitivity. I used to be so much more. You should see I'm like covered in tattoos. I'm a hard-looking guy, but I was once told I have honorary ovaries, and because you develop these things, taking care of women. So,
God, you think that the military vagina would toughen you up?
Well, that's why I say I'm a combat gynecologist.
Combat
gynecologist sounds more hardcore.
That is fantastic. So, natalizumab. What's natalizumab?
That one I don't. No.
For our audience, I think it's interesting. You should see that you'll look back at this as the first time that I'm doing a content-based review on question bank questions. And for those of you that actually, if you're able to learn in this way, I hope you'll write into us and let us know, because I was not certain whether you could actually do questions, multiple choice questions verbally only. But so many people seem to want things that they could listen to in the car and while they're brushing their teeth.
Yeah, Dr. Fischer, that's why we have this podcast.
Well,
it was a need.
But it's an experiment, and I need to hear back from people. I need to hear that this is effective.
Please, everyone tweet CFish. Tweet at CFish.
Yeah, I need to hear what else people want in the podcast and whether it's effective, what we could do better. See, that's what you do. And if you want to say to your residency director someday, you don't want to say, am I wrong about something? You say, is there anything I can do differently? Is there anything I can do differently? So we're going to keep going on this, and that you must send in the feedback so that we know what we can do differently to help your education. So natalizumab is a wrong answer, because natalizumab is an alpha integrin inhibitor. Natalizumab is used for multiple sclerosis. Natalizumab used to prevent progression of multiple sclerosis. But the question you're going to get asked on step 1, besides it being an alpha integrin inhibitor, is that natalizumab has a unique adverse effect. Natalizumab, N-A-T-A-L, natalizumab causes PML. It unlocks the JC virus. JC virus, which does not stand for Jakob Creutzfeldt or Jesus Christ, but the John Cunningham, the first patient who ever had it. Natalizumab is wrong because that's an alpha integrin inhibitor for MS and for inflammatory bowel disease. Vitamin K reverses warfarin, but is too slow. Dialysis does not reverse any anticoagulant. And protamine sulfate. Protamine sulfate is taking salmon testicles and putting them into a food processor, so you get a salmon testicle smoothie. Ooh, how nice. And what is protamine for? You'll know it because it's old. Protamine sulfate reverses
heparin.
There you go.
Gotta know that one.
There you go. Fresh frozen plasma reverses all deficiencies of factor deficiencies, reverses all factor deficiencies, except...
Ooh, is it factor 8?
Oh, very good. Patrick shoots. Patrick got the rebound. Patrick scores.
And since I got that right, I just want everyone to know that that was from memory.
That's it.
But I use FFP occasionally.
Ooh, okay. Let's add on to this one for extra bonus points for the brand new car in the dream home in Cincinnati. What reverses severe warfarin overdose, Coumadin overdose, and the answer is not fresh frozen plasma. What?
Cryoprecipitate?
Thank you for playing. Cryoprecipitate is the wrong answer, but an important choice. Cryoprecipitate is high in fibrinogen content. Cryoprecipitate is used for DIC. Oh, no, I'm sorry, DIC. It's used for DIC.
Well, I guess then just recombinant factor 7, right?
Close, said the ectopic pregnancy. I was close to the uterus. You're in the fallopian tube. So close, but still not close enough.
Consult medicine.
So let's say the question again. What reverses severe warfarin toxicity, INR of 10, severe bleeding, and when you absolutely, positively got to reverse it overnight? How do you FedEx those factors? And it's not fresh frozen plasma, and it's not vitamin K, because vitamin K is much too
slow.
No, exactly. Vitamin K is like masturbating with myasthenia gravis. You get tired and it goes too slow. The fastest way to reverse warfarin toxicity is prothrombin complex concentrate. Prothrombin complex concentrate. PCC. Now, ladies and gentlemen, just like we said that the Cramathon was to find holes in your knowledge base, if you're doing this as an audio only right now, this is the type that you should pause, write that down, and look it up. Do not think that you're going to learn things just from one shot through. Prothrombin, okay, let me do I'll do my official podcast version. Ready?
Let me count it down. Hey, my show. I'm going to count it down for you. 3, 2, 1.
Prothrombin complex concentrate is a collection of all the vitamin K-dependent clotting factors. Factors 2, 7, 9, 10, protein C, and protein S. This substance, PCC, or prothrombin complex concentrate, is the fastest way to reverse warfarin toxicity and is created specifically for warfarin overdose. It gives you only the factors that are vitamin K dependent.
That was perfect.
Do you like that?
Yeah, you should.
That's what you want to do more? Okay.
Yeah, exactly. I need more of these. You have to record these segments for me. We'll put them in the, integrate them into the transitions of the show. That'd be perfect. You have a great radio voice.
All right, we'll do those. Okay, I just show you that I can be socially appropriate if I try.
Okay. All right, back to the question. So idarucizumab.
Idarucizumab reverses dabigatran. You know, I will tell you that I will think we'll do more of these because I like this more than I expected to. So dabigatran, the reversal agent idarucizumab. Let's do the next one.
All right, one more. I don't want to take too much of your time.
Let's do two more. Let's do two more. I'm having a good two more. They're short.
Okay. So a 70-year-old woman with osteoporosis and a T-score of negative 2.5 by DEXA scan comes to the physician for a health maintenance examination. She takes adequate supplements of calcium and vitamin D. Which of the following drugs should be used as the first-line therapy to reduce her incidence of hip fracture? Answer choices are A, calcitonin, B, raloxifene, C, teriparatide, D, alendronate, or E, my favorite, estrogen.
So the first thing to do is to see that all of these choices do treat osteoporosis.
Absolutely. And that can be a frustrating experience for a student when you're on an exam.
Exactly.
Forgetting that it is the single best
Correct.
answer. They might all be correct answers. It's the single best answer you're looking for.
Yes. So alendronate is the answer because bisphosphonates inhibit osteoclasts. And bisphosphonates, by inhibiting osteoclasts, prevent bone from being broken down. Now, calcitonin also inhibits osteoclasts. How come calcitonin was the wrong answer? And that's because calcitonin exhibits a phenomena called tachyphylaxis. What's tachyphylaxis?
Body gets used to it, drug doesn't work.
There you go. So calcitonin wears off. But when is calcitonin the answer then? It's the answer for?
It's about a third line, so in the need to immediately, for short bursts of treatment, whenever that would be indicated.
Correct, for acute hypercalcemia that needs an instant response. When you have a patient with acute hypercalcemia and they have mental status changes, abdominal pain, and polyuria, and your hydration has not been effective, calcitonin works much faster than bisphosphonates. Calcitonin works fast, wears off fast. Now,
there you go.
What is raloxifene? Raloxifene keeps the bone hard.
It's a SERM.
It's a SERM, a selective estrogen receptor modifying drug. Selective. It's selective because it hardens my bone, but inhibits my breast cancer. It's agonistic on the bone, but antagonistic on the breasts. Raloxifene, tamoxifen, raloxifene to harden my bone and protect my breasts. Teriparatide. Teriparatide. Who is Terry? What is teriparatide? Teriparatide is a synthetic version of parathyroid hormone, PTH. Oh, but fishy, how could PTH harden my bone? Ooh, very good question, Johnny. Teriparatide, although it is parathyroid hormone, takes advantage of a very important mechanism in physiology for step 1 called downregulation. You see, under constant exposure, parathyroid hormone will actually downregulate those osteoclasts. So it is the intermittent exposure to PTH that breaks down bone. Teriparatide gives a constant blood level of parathyroid hormone, so it actually blocks PTH effect on the bone. Ooh. Estrogen hardens your bone. It does. So how come we don't use estrogen first? There must be a reason.
Women's Health Study Initiative mainly, I think. But that might be a little too detailed for step 1 level students.
No, I don't think so. Knowing the name of specific studies is not necessary. Step 1's never going to say, what was the name of that study that did this? So the name of the study is not necessary, but the point of the study was very important. The point of the study is that they'll ask you, if estrogen hardens bone, how come it's not used first, second, or third in old ladies with osteoporosis? Do you remember that thing we called therapeutic index from the Paleozoic?
Vaguely.
Yes, therapeutic index said what was the toxic dose divided by the dose for efficacy, the effective or efficacious dose. So estrogen is effective in hardening bone, but it's also toxic. That's what killed estrogen. The study you referred to is called the Estrogen is More Trouble Than It's Worth study. Estrogen does,
at least in the media.
Yeah. Does estrogen harden the bone in a lady?
Yes.
Absolutely. And speaking as a premenopausal man myself, definitely. Estrogen hardens.
Premenopausal?
Yes. Estrogen hardens my bone. Yes. Now, the other thing is, why didn't it work? It was studied. And what ended up happening is that more women died of DVT, pulmonary emboli, and weirdly enough, cardiovascular disease. So the toxic dose was not worth the drug. Preventing the osteoporosis was less than causing adverse effects of DVT, PE, thromboembolic disease, I see. DVT and PE, sudden short of breath, I see. DVT and PE, estrogen should not be inside of me. Because I got some good news and some bad news. You're going to have the greatest bone density in the funeral home.
That would not work as a marketing slogan.
So I think we got to stop, man. I think we got to stop at the time. This was much better.
This is great.
Much better.
Thank you.
But remember what I said to everybody out there in Cyberland. I want to hear what you want done differently. Patrick and I will get these smoother and smoother over time. I think they should be 20 to 30 minutes. But we want to hear from you what you want us to do different. Other than that, okay, from Inside the Boards and MedQuest Test Prep, we wish you very well. Hope to see you at the Cramathon.
Hope to see you next Thursday.
Oh, next Thursday, right? I forgot Thursday is 6, 8 p.m. Eastern Standard Time. Peace, folks.
All right, that concludes our interview and question dissection with Conrad Fischer. Like he was saying, definitely send us some feedback. We'd love to hear if this is helping you, if there's anything that we could be doing better, if there's any way that we could do anything to help make studying easier for you. We want to know because we want to help you succeed on the boards. Also, if you'd like to help us out a little bit, if you would go and leave a review for us on iTunes or your podcast app, and if you'd share us with your medical school class and other second-year medical students who are in board preparation mode, it would be an amazing help for us. All right, thanks a lot.
Inside the Boards is not affiliated with the United States Medical Licensing Examination, Comprehensive Osteopathic Medical Licensing Examination, National Board of Medical Examiners, National Board of Osteopathic Medical Examiners, or any other licensing or examination body. All exam names or other trademarks are the property of the respective trademark owners. Content discussed during this program is the property of Inside the Boards or the attributed owner and may not be reproduced without permission from the appropriate entity. Inside the Boards fully adheres to the respective policies on irregular behavior outlined by the aforementioned credentialing bodies. All content discussed is for educational purposes and should not be construed as medical advice.